what happens to the breasts after the implants are removed? And why does explant surgery alone maybe not leave women happy with what they're left with if it's just the implant going out?
Well, obviously, the women that have implants made the decision to put them in for some reason. So that reason is going to come back. And, whether it is the breast was too small or whether it is the breast was saggy a little bit and I needed more volume to fill it after breastfeeding or after weight loss. But that reason comes back to haunt them. And sometimes they're sort of like, don't mind it anymore. A lot of patients sort of like accept that. It's like, well, it's going to be smaller, but you know what? It's me. It's natural. It's not a problem. But a lot of patients do want to optimize the shape afterwards because now that that implant is gone, the shape goes back to what it was. And that's actually the best case scenario. A lot of times, if the implant was there for 10, 20, 30 years, or if the implant was very large, obviously there's 10, 20, 30 years of aging that has also affected that breast over that time frame. So maybe the skin is even looser, maybe the breast footprint is even lower, the nipple has descended even more. And now where that implant is out, the breast looks a lot worse than when that implant was first being considered to be put in. Now we're dealing with all those sequelae.
Sequelae, what's that mean? Sorry.
And now we're dealing with all of those, consequences of time and aging and stuff like that.
Got it.
So now the solutions to this problem are a lot more complicated because now we are restricted by volume, because really the only way to add volume to a breast is implant or fat grafting. So if implant is off the table, we got to get into the more complex, addition of volume, which is fat grafting, which involves liposuction from somewhere else on that patient, and then, processing the fat and injecting the fat back into the breast.
Mm-hmm.
That's a much more complicated procedure. That's, a lengthier procedure. Or a lift, which is rearranging the breast tissue altogether with maybe augmentation, which is another tissue preservation techniques, basically gathering breast tissue from different places and rearranging it and stacking it on itself for better shape. All those are reconstructive techniques, and they're a lot more complex than just putting a foreign object under a breast.
Yeah. How should patients think about their goals before choosing an explant versus maybe an explant plus some of these reconstructive techniques? And, what kinds of questions do you ask them to think about for that end result?
I suppose the goals are, first of all, I would be realistic about the outcome. So I think the biggest decision that patients make when they no longer want an implant is that they sort of want to stop the maintenance of having a foreign object. No implant is forever. The implants have a shelf life which is shorter than the patient's lifespan. In almost all cases, I tell this to patients who are in their late 70s who are considering an implant, because that implant realistically, 10 or 15 years, it could rupture, or even sooner. And then patient at 85 will be in that same situation. So the implant is not forever. And if you're willing to continue the maintenance and be, willing to have another surgery down the line in your lifetime, then the implant may still be the option for you, assuming you didn't have any complications or assuming there's no other issues. I think a lot of patients that decide not to have an implant anymore are sort of just at the stage where like, you know what, I'm going to accept a smaller volume, but I don't want that maintenance anymore. I'll be comfortable with either smaller volume or just better shape or whatever the goals are at that point. And then we discuss the options.
Like the auto augmentation.